Dr. C coming to you from Springfield, Missouri, and it's April 3rd, 2020. We're all in the middle of this COVID-19 devastation, and just wanted to do a quick introduction here to what the story is. My motivation for doing this, by the way, this is my first video that I've ever done on YouTube, so please be forgiving. Again, I see a lot of things going on here in Missouri that is not very good in terms of people heeding the warnings and behaving in a way that would help stop this virus from spreading. So anyway, before I get into that, my major concern here is just a quick update in terms of the world scene. Here we have over 1 million people. In terms of confirmed cases, probably a heck of a lot more than that. Total deaths, over 50,000 in the world. Again, you can see on this area right down here that the virus is in fact still doing a lot of damage, and we're still on an uphill projection here. But the real story I want to tell is what's going on in United States, of course, and more specifically Missouri. So let's just take a quick look at that. Here's the projections from a site, COVID-19.healthdata.org, and they're pretty good as far as I know. This is pretty reputable. So what's the story? The story is that for the whole United States, we're right here. This is April 3rd. If we look down here, this is resources needed, and we see that curve that everybody's been talking about. April 3rd here, we have about 2 weeks in terms of maxing out in the United States in terms of hospital resources that'll be required. If we look down here, a little more relevant, again, we're sitting here at April 3rd, and what we notice is this is deaths. Okay, so it looks like in terms of the United States as a whole, the number of deaths will peak out again 2 weeks from now, from today, which is again April 3rd. Notice the wide range here. Again, that's because it's hard to predict this stuff with so little data, to be perfectly honest. But we also notice how wide and how long and stretched out this bell-shaped curve is on the right-hand side. That's because of all the different states reaching their maximum deaths coming later than New York. In fact, we'll take a quick look at New York, but in a minute. But next we see down here, this is accumulated or total deaths predicted for the United States. Could be anywhere from about 40,000 to about almost 200,000. Again, just from the coronavirus. So let's take a quick look at New York, because they're the ones that we see every day in the news, and with Governor Cuomo, of course, giving an excellent report every morning about that. So we can scroll right here to New York and see what the story is for New York. In fact, this is what this is really showing here. The purple line that we see across the bottom here, that's the number of beds available versus the number of beds needed. So here we are, let's see, April 3rd, right here. Notice New York will max out in about 6 days from now, about a week, in terms of resources necessary. We've passed the inflection point here, or at least in terms of the prediction, although the cases might still be going up, which we'll talk about later. Notice that the purple line across here at the bottom is what's available. What we see here is what's needed. So again, New York is in bad shape. No way do they have the resources needed compared to what's projected, which again is the dashed line here. And the range of possibility is, of course, the shaded area right here. Deaths per day will max out in 7 days in a week. At about, again, what is it, about almost 1,000 deaths per day in about a week. Cumulative total for New York State, yeah, again, ranges anywhere from 20,000 to 10,000 total deaths when it's all said and done. The interesting thing about New York here is that the whole process seems to for at least New York, will be over by May. Again, that's assuming everything stays the same as the way it is, and none of the variables that go into these projections have changed. That people are behaving the same as they are or they have been, and that in other words, everything stays the same, and there's no drastic change in anything with regard to the way people behave, or in terms of drugs available, or hospital resources, or anything like that. So interestingly, again, New York State should be, pretty much done by the end of May. If we look at now, again, that's assuming the model's correct. All right, let's quickly let's put this here, and now again, deaths per day. Now let's shift to Missouri, which is really where I'm from. We're in Springfield, Missouri, right here now, and I want to basically go back. Yeah, we have to go to Dean, heading up to Missouri, and we'll see a totally different story. Okay, here we go, Missouri. Whoa. Okay, number of deaths in Missouri. Notice the wide range of unpredictability. Notice the actual number of deaths that we've recorded so far is very, very, very low. But we're right here on the chart, April 3rd. But notice the most important thing here is that things will not be the worst for Missouri until almost June, if things continue the way they're going. Notice the wide shaded band here. The wide shaded band here shows you how much variability there is in these projections. In terms of availability of resources, we see here it appears like we're looking at all beds available. We have a total number here, the purple line at the top in Missouri. All beds available is about 8,000. It appears we'll only need a lot less than that right down here. But so it doesn't look like we'll run out of beds in terms of resources for Missouri. In terms of ICU beds for people who are very sick, obviously, and are, maybe on the brink of death or possibly. This is the available ICU beds in the whole state of Missouri, right here, this green line. And it's possible that we do overrun our available beds. Again, the realm of possibility is anywhere in the green shade here. Most likely is right here, the dotted line. So at least this projection says we probably won't run out of ICU beds. But again, we'll see. We're still right here. Right here, April 3rd was still right at the beginning of the exponential point in Missouri. And that's really what I want to emphasize, is how Missouri here is at the very beginning of what's about to happen. Notice also that in terms of, we go down here to deaths, we don't expect to see the max until 45 days from now in terms of deaths per day. But Missouri's gonna be in bad shape until after July. In other words, we're still having deaths and contagion until well into July, possibly. So notice we're right here, April 3rd, and so we got a long way to go here for Missouri. We're going to be stretched out. This is a perfect example of that curve being really stretched out, wow. So Missouri, be prepared to not see people for a long time, or at least that's what I hope to get across in this, is that we stay home and take care of ourselves and don't transmit this virus, because the best we do now can completely determine where in this red region we are. If everybody stayed home today, from this moment on, we'd probably be right down here at the very bottom, and the number of deaths would be very low. Okay, let's in fact this look at here, which is total number of deaths. That what we just saw was deaths per day. If we're really good and we stayed home, again, look where we are. We're right here, April 3rd, total number of deaths. I mean, we haven't even begun to see the results yet in Missouri. If we're really good about it and everybody stayed home, we might actually follow the bottom of the yellow line here. Imagine that. And the total number of deaths would be no more than about 200 or so. Okay. Again, but that's not the most likely outcome. The most likely outcome is here, that there'll be at least 1,000 deaths in Missouri. But again, this is the best available data. But again, I want to impress upon you how we react and whether or not we're hanging out with people and transmitting this virus will determine where we lie in these shaded areas. Okay, if we act foolishly, we could be more towards the top here of the shaded area and have several thousand dead in Missouri. Okay, so that's the story with regard to predicting the model in terms of time and this curve that everybody's been talking about, trying to lower the curve. This is what it's all about, lowering this curve. What I want to show now is some forecasting that I've done locally with regard to, again, just Missouri, because we have some data from Missouri that's statistically relevant enough to make even any predictions to see what's going on. Now let me show you very quickly here in terms of this is what I did using a very simple, looking at data here. This is data. We're plotting total cases. I should have put that here actually. This is total cases as a function of time, as a function of date here. So not cases per day. This is total cases. This is using what we call an exponential smoothing model, where we make two assumptions: that the data is in fact exponentially increasing, and that the next day's value is some function of what happened previously. In other words, can we predict into the future a little bit by modeling the trend that we already have in the data? So this modeling here makes absolutely no assumption than the blue data points whatsoever. So the blue data points here are the real number of cases that have been recorded. Now again, that doesn't mean that that's a true number. The number of actual cases in Missouri might be 10 times higher. But assuming that the availability of cases, availability of getting tested is the same over time, then at least we can see trends, and and even if the absolute numbers are off. So the key point here again is the blue is the actual number of cases, total cases, cumulative cases, up to, this is the second here, up to yesterday. The red is our model, which again assumes exponential, that the growth will be exponential in behavior, meaning that it's multiplicative. It gets higher and higher and higher by a certain multiple. The other thing is, again, it assumes that each value depends on some degree on the values beforehand. So this is called exponential smoothing forecasting. To make a long story short, tomorrow, actually this is today's forecast right here on the 3rd, which is about, say, 2,200. And we see that the predictions are for it to go up and continue a nice trend. The actual forecast for today, this is again, is actually right around that exact number. Let me pull it up very quickly just to see. Again, this is from the Department of Health and and Social Services, Missouri Department of Health and Senior Services, sorry. The outbreak for today, updated on April 3rd, 2,100. So there's 2,113 deaths so far as of today. Total deaths is 19. Let's go back to the model and see. Oops, sorry, that's the deaths. Let's go back to the, sorry. 2,100 was the actual. So the model is pretty straight, pretty dead on. Again, these kinds of models, they get less accurate in terms of their predictions the further ahead in time you go, or the further out you go from the actual raw data, from the actual real data. The further ahead you predict, the less accurate you're going to be, obviously, because you're getting further away from the actual data. But this is the best we could do in terms of trying to predict what the next 4 days are going to look like in terms of total cases in Missouri. But the model's holding up very well. The green line here, the green is nothing more than what we call the residuals, and that's on the right-hand side. The residuals is the error that the model has compared to the predictions. Actually, let me say that again. The green represents the difference between the model and the actual data points. In other words, it's a reflection of how well does the model fit the data. For those of you who are technically inclined, the average of the data should be 0 for a good model, and it looks pretty darn close to that. The average should be 0, and it should also be normally distributed. And basically that means it should have a bell-shaped curve in terms of how far away from 0 the numbers actually are in terms of plus and minus. So the errors, that's the key point. The residuals are the errors in the model. They should be as close to 0 as possible in terms of the mean or the average error, and it should be up and down. It should be, they should have some errors that are above 0 and some errors that are below, some that overestimate, some that underestimate. As we can see, this is how we judge different models, by assuming by looking at the residuals and looking at the errors that the model has, comparing the predictions to the real data. So this model is actually pretty good, and it proves itself out in the sense that this 1 day ahead forecast right here is pretty much right dead on. Again, notice things kind of went a little crazy here in these days, but not really, because the model is only within 12% mean absolute percent error. What does that mean? It means that even though the prediction here was, say, about 2,200 in terms of number of total cases, we have you can be within 12% error of that. So within 12% error, 12% is close to 10%. So figure you could be off by about 200. So predicts 2,200. You can be off by about 200 on average. Okay, for this prediction. We're well within the prediction range here. So there's no question that Missouri is still in an exponential trend here with regard to the number of cases reported, the total number of cases reported. And people have talked to me about this. Oh yeah, but we don't know the true total number of cases. Well, again, that might be true. In fact, it's almost definitely true, because at least in Missouri or Springfield area, at least, you're told to stay home, okay, if you're sick, and you may have COVID virus and nobody tested you, or you're not going to be tested unless your doctor says to, or you're in the hospital. So these numbers clearly underestimate the number of cases, the number of true cases that are in the population. But the real information here comes in the fact of the trend. If the availability of getting tested remains constant, if the number of people that are told to get tests remains constant, if the behavior of the population remains constant, then this trend should be the same, even if the absolute numbers are actually off. But there's no question that we're in an exponential trend in terms of number of cases. Even if these values are off by a factor of 10, it doesn't matter. The trend is still holding. The only other thing you could say is that, well, maybe you're trending up because more people are getting tested. Well, it might be true. It might be true. But again, we're assuming that the rules that are guiding the number of people getting tested are actually the same throughout the past 2 weeks or so. In which case the trend is real and is not a reflection of just simply more testing, but in fact a reflection of having more people being sick. So let's take a look then very quickly at the number of deaths. Now the number of deaths that's a different ball game here, and that's a little tricky, and I'll tell you why. It's tricky because the numbers are so. Whoops, this is cases. Sorry. We'll look at number of deaths. Sorry, here we go. So the number of deaths, the numbers are so low, it's really, really hard to make any prediction. Again, this is the best we could do, assuming that the number of cases are exponentially increasing. You look at the actual number of total deaths on any day, and again, these numbers are so low that it's very hard to say anything definitive. In fact, right here is today's prediction, which is about, say, 22, and there was still only 19 people total dead in Missouri. So it's a little. Although this date is probably more accurate because they've probably tested people who have died. Then again, I don't know. I don't know for sure. But there's no question that this is either linear, in the sense that it's maybe better modeled as a straight line rather than exponential. We'll know in a few more days as we get more data coming in as to what the story is there. But again, the deaths are going up. Now, whether it's truly exponential, I'm anticipating it is, because of all the things we saw on the website with regard to the models, saying that Missouri is not going to peak out until about 2 months from now. So again, these are my attempts at trying to model what's going on in Missouri. I want to just say a few things. Again, for you young people, man, please don't ignore this stuff. Please don't. This is crazy. Bad news here. Okay, so don't be responsible for getting one of your older members of your family sick, please, or possibly ill. Again, I want to emphasize that there's so much on the web here to look at. In fact, this is Missouri and the distribution of cases within Missouri. Again, we said it was 2113 as of today, April 3rd. Greene County is right down here, 60 cases in Greene County. Total number of dead in Missouri is 19. Again, low numbers, so it's hard to make a prediction. Distribution between male and female breakdowns, again, doesn't seem, statistically that's the same. Again, there's no real prevalence over another. One thing I want to bring your attention to very quickly is the age prevalence. We can expand this right here and take a look at Missouri's age prevalence. Well, right down here, this is the number of 20 to 24-year-olds who are getting coronavirus, who are definitely testing positive for coronavirus. So please, you young people, don't ignore this. That's all I can tell you. Don't ignore it. That's not a low number. And obviously gets higher here in terms of the number of cases with regard to your age. But this is a sort of a skewed way of looking at things, in the sense that there are many more people in the population around this age group right here. There's not that many people over here, 75 or even 80. So again, although this is telling you the absolute numbers, it's not telling you relative risk. It's not telling you who is more susceptible to being reported as having to testing positive for this data really needs to be normalized against the prevalence or the actual number of people, percent of people that are in each of these age ranges. I'll show you that tomorrow, and we'll take a look at that. But anyway, I hope this has helped a little bit with regard to understanding. And again, all I gotta say is, please, my wife and I, we're retired. I'm retired. My wife's disabled, and I'm going out not even every 5-6 days or something, maybe to get some food or supplies, but that's it. And I go out in different clothes, and I keep my clothes that I go out with in the garage. I change I take strip down in the garage, leave those clothes in the garage. I wear gloves. CDC today just recommended, hey, use some masks when you go out. It might help. Yeah, and I have hand dispenser, a hand sanitizer, and bleach, and we wash everything down that comes in the house. My wife is immunocompromised, so I cannot take a chance on her catching this. I'm also over 60 and have diabetes, and so I'm at risk for this as well. So anyway, I hope you have enjoyed what I've said so far, and gotten some information out of it in terms of a technical analysis, and we'll look at this further down the line. But again, feel free to donate. Again, it's to help us out here and to help me pay for the statistical software that I've used to do these analyses, and a few other things. So again, you could just go to paypal.me/Dean Cuevas. And my name again is Dean Cuevas right here. And again, paypal.me/Dean Cuevas, all one word. And again, if you like donating anything, believe me, we could sure use it. Anyway, so have yourselves a great day. May God bless you all and keep you safe. And we'll keep an eye on what's going on in Missouri and see what the trends look like. Please stay in. Okay, this is Dean Cuevas, Dr. C, signing off. Have a great day.